Okay, so I feel very privileged to work with this amazing organisation. To be honest with you, I've never been to Funda Nenja until yesterday. So I was blown away, yeah. So I am very privileged. Okay, so that's me, Midmar Veterinary Services. I'm a private vet that is contracted to Funda Nenja. We're basically contracted to spay or sterilise 15 dogs a month. So that's what we do for them. Danny was just mentioning, and this is a bit of a twofold thing because I'm going to talk about what we do at Funda Nenja, but also ideas for you guys out there in the big wide world. So get a relationship with your local vet. And Funda Nenja are very diplomatic in this instance because Danny works for another vet practice and I'm another one in town. So any of the sick animals that come through Funda Nenja go to Danny's practice, Howick Veterinary Clinic, and then I do the side of it. So I think it works quite well and they're keeping both veterinary businesses happy. So yeah. And vets are very odd people, hey? So keep in with your vet. Don't make them rub each other up the wrong way. All right. Okay, funding, that's going to be covered just now, but obviously veterinary care costs a hell of a lot of money. So, yeah, it's a big thing. All right. Legalities. Dr. Danny did touch on it a little bit about not carrying euthanase, etc., etc. Don't approach your local vet and say, hey, come to my township and sterilise for me, because that vet will get struck off the roll and they'll never be able to practice again. So don't put them in that situation. Go and discuss it with them. It's quite a big thing to be registered as a mobile facility. Lots of paperwork. It's doable. There are not enough vets that are registered. Or it's not a registration, it's actually an accreditation. So you have to have a veterinary practice that's registered, and then you have to be accredited with council to be able to do mobile work. I have a bit of an issue with my clients because now I'm accredited to do mass sterilisation clinics. So I get a phone call from Mrs. Jones and she'll say, why don't you come and spay Snoopy on my kitchen table? I don't do that. So I won't work for you as an individual. I will work for an NPO. Okay, so, and that's just, I just keep that distance because otherwise it just gets too complicated. And if I overstep the mark and get a black mark against my name, that's my career down the tubes. Yeah, okay. Right, equipment. To do these mass steri campaigns, you need a hell of a lot of equipment. I have been told that I'm an expensive bitch because I do charge for my services, but I'll tell you that a spay set's going to set you back 20 Gs. I've got 6 spay sets because when I go out, we do a lot of animals. Okay, so equipment is very, very important. Important to have the right equipment that's serviced correctly, that's cleaned correctly. Obviously, preparation for the clinics is important. Everything's got to go through the autoclave. So you've got to have your ducks in a row. It's not just pitching up at 8 o'clock in the morning and doing the spays. It's a lot of preparation beforehand. Those are just sterile packs that go into the autoclave. Right, I had a question yesterday when we were looking at the classroom where my operating table is. Okay, so that is the classroom you saw yesterday. It's very different today. I'm very, very fortunate. I have my right-hand lady, Di, who's sitting at the back there. So we work as a team together. And we have to cart the stuff up those stairs, along that corridor, to whichever clinic we're doing. Okay, and it's a lot of equipment. So I've got 2 stainless steel tables, those little yellow tables, which are just for storage. I carry an anesthetic machine with me with oxygen. Not many vets will work in the field with an anesthetic machine. I'm a bit of a wuss. My animals are on anesthetic machine because if I have a problem, I want to know that that animal's going to survive while I fiddle around inside its abdomen. Okay, so it's a lot of equipment to carry. We have to get a lot of muscles to carry it. So yeah, that's another thing. Okay, and not the average vet's not going to have 6 spay sets. So that's another factor to factor in when you approach your local vet. Sterilising in the field, the positives and the negatives. Obviously, Funda Nenja is huge on education. I'm also big on education. So the positives, easier for the pet owners to get there. Education while working. There's a big fallacy like, oh, I need my dog sterilised, so it goes into a welfare organisation and it might have to sit in a queue for a couple of days. Might not come out, and there's not that communication. So when I work, especially at Funda Nenja, I mean, we're so lucky because Nomondi's prep the owners before the animals are booked in, so we know on Friday afternoon we know how many dogs are coming, paperwork's done, etc., etc. Okay, so I can go out. I don't have to worry about all the admin and stuff, but on that corridor outside the classroom is where the kids wait with their dogs. Okay. So I'll call dog number 1, Nomondi will call the kid, she's got the name there, and I interact with that child and the dog. So they hold the dog, I give it the injection, and I tell them that their dog's going to get a little bit drunk and it's going to vomit. And I think for them having the vet actually talking to them, I mean, it doesn't sound big-headed or anything, but yeah, it's quite a nice thing. And then the other thing that I found is so important is that they see how we handle the dogs. So we don't drag it out the cage by its tail. We carry it carefully. And I think that's a huge education in itself, and that's the whole Funda Nenja thing as well, is look and see how we work with them, and they're going to learn from that. Yeah. And we don't have the kids or the owners in the classroom with us because it would get a little bit busy. But if they want to look through the window, I don't have a problem with that. And if I have a specific, like some of the older ones, they want to see, then they must come in. The other thing is we use the Funda Nenja team as our assistants. And I think, I mean, Adrian mentioned that there are a couple of them, though, they're now working in grooming parlours, they're working in vet clinics. So they're getting their apprenticeship on a Saturday morning, you know. So we do have an animal health technician that comes in and does my anaesthetic inductions for me. And then the Funda Nenja team do the shaving and the prep for theatre. And I can tell you, the prep for theatre is important because that's where your infection starts. And these guys, I mean, we're real old witches. We hammer them. We hammer them, hammer them, hammer them. And they learn. So when they get to a vet clinic for their new job, they know what to do. So I think it's a teaching thing for the Funda Nenja staff, and then obviously the little owners out there as well. Okay. The dogs go home sooner, and obviously the dogs the owners take a little bit of responsibility because they are holding the dog when I give it its first injection, which is a sore injection, and then they're going to come and take it out the cage and go home with it. The negatives, obviously, I've talked about the equipment to set up. There's no hospital facility, and backup is a bit further away. So obviously, if you do have a major problem, you could be in trouble. But that's unfortunately welfare and the understanding that goes with it. From a technical side, well, I've pretty much covered that. But yeah, so I do the pre-medication. I do it myself. Legally, with the Vet Council rules, I have to examine every dog before it goes through. So we are a little bit hairy casual because we don't do a full clinical. It's also damn difficult to put a stethoscope on a dog that wants to bite you because you're going quite close to its face. So, you know, we sort of look at the mucous membrane color, their general well-being. Obviously, you can see quite a lot from that. If you've got a problem, then you're going to look a little bit further. So I do that. Then I have an animal health technician, Debbie, who does our inductions for anesthetic. We put a tube down every single dog's throat, so we've got an open airway. They all have an intravenous catheter taped in, so I've got my safety mechanisms in place. They get tipped upside down, shaved, prepped, as I've discussed. We do use pain control. We give them an injection, a 24-hour anti-inflammatory stroke pain control. Whether it's good or bad medicine, we do give them a penicillin injection as well. We're not in a theatre, we're in a classroom, so we just cover that base. You will get the sort of microbiologist saying that it's bad medicine, it's promoting antibiotic resistance. I'm not there. I don't want an infection. Suture materials is a controversial topic, especially when I do the feral cat work, because what do you do with those stitches? Nylon stitches can live in the animal forever. But if you put a stitch in that's going to undo or break down and the intestines fall out, that animal's not going to live forever. So I do go a little bit big on my suture materials. I use nylon in the muscle layer, and then I use a thinner nylon in the underneath layer and then in the skin. So I make sure that the animal doesn't fall apart. And if it lives with stitches, it's fine. You know it's been sprayed at the end of the day. Yeah. Oh, and Nurse Namandi takes them out on her home visits, so that's awesome. Yeah. You do have to be careful. You don't want to put very tight stitches in because it does encourage the dogs to lick. So, but you learn that as you go along. And then recovery, we put up those cages that you saw stacked against the wall in the classroom. We put them up in the classroom, and the dogs recover in the classroom. When I had my veterinary council inspection, it was one criticism that the inspector had. He said he wanted my theatre in a separate room. I said to him, it can't happen. I'm in charge here. I'm the only vet here. I need to see what's going on. So those dogs recover in front of me. Mr. Neni, who was there yesterday, he's not here today. Hey. He is an elderly volunteer for Funda Nenja. He is incredibly possessive over his recovery post. So he will take the dog off the table. Doesn't matter if it's 100 kilograms or 5 kilograms, he'll take it off. He takes the tube out, so we've taught him how to do that. He cleans my wound. He puts purple spray on for me, and he takes the catheter out the vein. So we've got a really nice system going, and everybody works so well together, which is absolutely awesome. Sometimes we have to make plans, so that's and somebody trying to hang a drip up on the windowsill because we needed to give the dog a drip. So yes, you've got to think out the box. So yeah, that happens. And then it's all about enjoying your job. So that was some cupcakes and soccer balls. Yeah. So that's the fun that we have with Funda Nenja. I just want to make one other statement just for you guys sort of thinking of doing the work out in wherever you live. As we've learned with Funda Nenja, learn about your community before you blast your way in there, okay? Because you cannot go in there and just grab dogs and say, we're going to spay them, or even vaccinate them. They've got to understand, okay? And then also make an effort. We might be odd, grumpy profession, but we are approachable. So get hold of your local vet and say, hey, can I take you for coffee? And ask them questions. Learn about the veterinary care yourself, because it's frightening what goes on there with people who think they know everything. Okay. Oh, and I'm a bit shy to admit this, but every animal that gets sterilized gets a rabies shot as well. But that's Kevin's fault, because Kevin has told us that anything that's moving slow enough to get a rabies vaccination has to get it. So they get a rabies shot. And we actually also give each dog ivermectin injection, which is sponsored by the government. And that obviously also does your ticks, fleas, mangers, and it's, so...